This tiny pill, so small you might not even see it clearly, holds tremendous power. It has saved approximately 100,000 lives every year. It's astounding to think that something so small can have such a massive impact, isn't it? This life-saving effect comes from its ability to prevent blood clots. Blood clots can block arteries and cause heart attacks or strokes, which are two of the leading causes of death worldwide. To give us an idea of its impact, aspirin is one of the oldest medications still in regular use in modern medicine, once even considered almost miraculous. In the 1970s and 80s, doctors began widely recommending it to reduce the risk of heart disease, especially for older individuals or those with a history of cardiovascular issues. However, in recent years, something has changed. More and more people have stopped taking this pill. And you may have also heard that its use isn't as recommended as it once was. This can sound confusing. If aspirin is so effective and accessible, shouldn't it still be the #1 choice for everyone? This change in recommendations has left many with questions, and we're here to clarify them. Today, we're going to explore together what has changed in the recommendations around aspirin and how we can make informed and safe decisions about its use. So, join us on this journey to better understand how and when to use aspirin safely and effectively. And if you haven't done so already, subscribe to the Wellness Insight channel and hit the notification bell so you won't miss any of our upcoming videos. Let's get started. The change in aspirin recommendations. For decades, aspirin has been one of the most widely recommended treatments for reducing the risk of cardiovascular events. This recommendation largely emerged because aspirin, by reducing the blood platelets' ability to clot, helps prevent blood clots from forming. If these clots block an artery, they can cause heart attacks and strokes, two of the leading causes of death worldwide. To many doctors, aspirin seemed like a simple and effective resource for keeping blood vessels clear. However, the recommendation for a daily aspirin has shifted significantly in recent years. In 2022, the United States Preventive Services Task Force, USPSTF, an independent committee that periodically reviews public health guidelines based on the latest scientific evidence, made an unexpected shift by advising against the widespread use of aspirin in people without a history of heart disease. This change surprised many, especially those who had developed the habit of taking daily aspirin to prevent heart problems. The basis for this change came from an in-depth review of studies on aspirin side effects, especially its bleeding risks. While aspirin can prevent blood clots, it also interferes with the clotting mechanism needed to stop bleeding when an injury to blood vessels occurs. Doctors observed that, in people without a history of heart issues, the benefit of clot prevention might be minimal compared to the risk of severe bleeding complications, such as stomach bleeding or even brain hemorrhages. Additionally, as research progressed, it became evident that not everyone responds to aspirin in the same way. There's a phenomenon called aspirin resistance, where some people do not achieve the same protection against clots. This variability in individual response raises another issue. Some may benefit from aspirin, while others may experience no preventive effect or even adverse effects. One of the most concerning side effects of aspirin is gastrointestinal bleeding. This type of bleeding occurs when aspirin irritates the stomach lining, increasing the risk of ulcers that, in severe cases, can cause significant hemorrhages. This risk is higher in older individuals and those already taking other medications, such as anticoagulants or certain pain relievers. Recent studies have also found that the risk of intracranial bleeding, though lower, can increase, and this risk, albeit small, may have devastating consequences. This factor was a key reason for the USPSTF's reassessment of their recommendations. For many, these changes have been confusing. Aspirin is an over-the-counter medication, and its use is so common that it has fostered a belief in its complete safety. This raises the question for many: why is a medication that has been promoted for decades now considered potentially risky? The answer lies in the accumulation of more detailed and extensive studies. As medicine has advanced, so too has the precision of long-term studies and the monitoring of side effects across different age groups and health conditions. These studies have shown that, for some people, especially those without a history of cardiovascular disease, aspirin may not only be unnecessary but potentially harmful. Another reason for the change in recommendations is the recent progress in other areas of cardiovascular prevention. Today, there are many more tools and strategies to reduce the risk of heart disease without relying on aspirin. Controlling blood pressure, maintaining a healthy weight, quitting smoking, and improving diet have proven to be as effective, if not more so, than aspirin for reducing cardiovascular risk in people without a history of heart issues. Additionally, other medications, such as statins, effectively lower cholesterol and offer preventive benefits without the same bleeding risks as aspirin. The change in aspirin recommendations reflects the ongoing evolution of medicine and the importance of tailoring treatments to individual needs. Aspirin remains a powerful tool in preventing cardiovascular events in those who have already experienced a heart issue. But for people without a history of heart disease, the benefits may not outweigh the bleeding risks. These new guidelines highlight the importance of personalized medical care, where each person receives a prevention plan tailored to their specific situation. This change serves as a reminder that even with commonly used medications, it is essential to consult healthcare professionals before starting a treatment, especially in the context of preventing complex diseases like cardiovascular disease. The history of aspirin. The history of aspirin is truly remarkable, a journey spanning thousands of years that continues to intrigue modern medicine. It all began with ancient civilizations like the Sumerians and Egyptians, who discovered the therapeutic properties of willow bark. Later, cultures such as the Greeks and Romans adopted this natural remedy as well. Hippocrates, often called the father of medicine, recommended a willow bark infusion to relieve pain and reduce fever, a practice that persisted for centuries. However, it wasn't until the 19th century that scientists began to understand how this substance worked, paving the way for the development of modern aspirin. In 1897, Felix Hoffmann synthesized acetylsalicylic acid, creating a more effective compound with fewer of the unpleasant side effects associated with natural salicylic acid, such as stomach irritation. His version, purer and gentler, became the foundation for Bayer's launch of aspirin in 1899. Aspirin was the first medicine to be mass-produced and distributed in tablet form, marking the birth of the modern pharmaceutical industry. What's fascinating is how aspirin evolved from being a mere pain reliever to a powerful tool in cardiovascular prevention. During World War II, doctors observed that patients who took aspirin regularly experienced fewer heart issues, a discovery that sparked interest in its effects on blood health. By the 1950s, researchers uncovered aspirin's antiplatelet effect, its ability to reduce platelet activity and thus lower the likelihood of clot formation. This was a monumental advance in preventive medicine, as it offered doctors the first tool to reduce heart attack risk in high-risk individuals. The mechanism behind this effect is intriguing. Aspirin blocks an essential enzyme, cyclooxygenase, COX, which is responsible for producing compounds called prostaglandins and thromboxanes. Prostaglandins play a role in inflammation and pain, while thromboxanes are crucial for platelet aggregation. By inhibiting COX, aspirin disrupts the production of these compounds, thereby alleviating pain and reducing fever, while also making platelets less sticky and less likely to form clots. This simple yet effective approach is why aspirin has become a cornerstone of cardiovascular medicine. However, this inhibition of cyclooxygenase is not entirely selective. It impacts platelets as well as other tissues, potentially causing side effects in the stomach, such as ulcers and bleeding. This is why, despite its potent preventive effects, aspirin must be used cautiously, especially in older adults or those with a predisposition to digestive problems. Balancing these benefits and risks has kept aspirin both relevant and a topic of ongoing scrutiny. The journey of aspirin also reminds us of how scientific discoveries can transform our lives in unforeseen ways. What began as a common pain reliever evolved into one of the first preventive therapies in cardiology, inspiring generations of researchers to explore treatments for chronic diseases. Even today, despite being one of the oldest and most thoroughly studied medications, aspirin continues to spark questions and drive new research, adapting to scientific advancements and proving that even the most familiar treatments still have more to offer and teach. Benefits and risks of aspirin. Aspirin, though seemingly simple, offers a unique combination of benefits and risks that must be carefully considered. Its ability to inhibit platelets and prevent blood clot formation makes it a powerful tool in cardiovascular prevention, particularly for individuals with a history of heart attacks or heart disease. By blocking an enzyme called cyclooxygenase, COX, aspirin reduces the production of thromboxanes, which promote clotting, and prostaglandins, which mediate inflammation and pain. This dual effect makes aspirin a versatile tool. On one hand, it alleviates pain and reduces inflammation, and on the other, it prevents platelets from clumping together and blocking blood flow in the arteries. These properties have earned aspirin a reputation as a heart protector. However, aspirin is not suitable for everyone or for every situation. Its blood-thinning effect, while helpful in preventing clots, can also compromise the body's natural bleeding control system. This poses a particular risk for older adults and those with digestive system fragility. By reducing prostaglandins, which protect the stomach lining from gastric acids, aspirin increases the likelihood of irritation and ulcers. Even small doses can damage the stomach lining over time, increasing the risk of gastrointestinal bleeding, a potentially severe complication that is especially common in people over 65. Cerebral bleeding is another serious concern, although less common. While aspirin doesn't directly cause this type of bleeding, by weakening the clotting ability, it can exacerbate the consequences of a head injury. Individuals with high blood pressure, whose blood vessels are already under constant pressure, are at an elevated risk of hemorrhagic events if they take aspirin regularly. This effect is delicate. While the drug may reduce clot formation, it could increase the risk of hemorrhage in people with hypertension. There is also the phenomenon of aspirin resistance, where the drug doesn't achieve the expected effect in some people due to genetic factors or underlying conditions like diabetes. This makes its use unpredictable, and in some cases, preventive aspirin treatment may not deliver the anticipated benefits. Beyond cardiovascular use, aspirin has been explored in other fields, such as cancer prevention. Some studies suggest it might offer a degree of protection against certain types of cancer, particularly colorectal cancer, due to its ability to reduce chronic inflammation, a factor in cancer cell development. However, these benefits are still under study and are not definitive, as the risk of bleeding and other adverse effects may outweigh the advantages for many people. In recent years, doctors have also begun focusing on alternative ways to reduce cardiovascular risk without relying solely on aspirin. A healthy lifestyle, including a balanced diet, regular exercise, and reduced tobacco and alcohol use, can have a significant impact on heart health. Additionally, medications like statins provide similar cardiovascular benefits without the bleeding risks associated with aspirin. Primary and secondary prevention. In the field of preventive medicine, two key concepts help define the appropriate type of treatment: primary prevention and secondary prevention. Though they sound similar, these terms are fundamental for understanding when and how aspirin, or any other intervention, should be used for heart health. Primary prevention involves taking steps before any signs or symptoms of a disease appear. This is a proactive approach aimed at preventing an issue, such as a heart attack or stroke, from happening in the first place. Here, the person has no symptoms or significant history of heart disease and seeks to stay healthy through habits like exercising, eating a balanced diet, and maintaining a healthy weight. For many years, aspirin was recommended as a primary prevention measure for older adults, assuming that its benefits outweighed any risks. However, recent studies have shown that in people without risk factors, the risk of side effects, especially bleeding, could outweigh the benefits of aspirin for primary prevention. Secondary prevention, on the other hand, is different. In this context, aspirin is used as an additional shield after the person has already shown signs of heart disease or has experienced an event like a heart attack or stroke. In other words, there is already a significant underlying risk, such as plaque in the arteries, and the goal is to prevent a repeat cardiovascular event. In these cases, aspirin is much more valuable because when the risk of new clots is high, the benefits of preventing them with aspirin outweigh the risk of bleeding. To better understand this distinction, consider a 50-year-old individual with no family history of heart disease, normal cholesterol, and normal blood pressure. This person would fall under primary prevention, and aspirin might not be necessary or beneficial. On the other hand, imagine someone who has already had a heart attack. In this case, the risk of another event is significantly higher, so aspirin as secondary prevention can substantially reduce that probability. Why is this distinction important? Because every time we take medication, we are balancing risks and benefits. For someone in primary prevention, the risk of bleeding might be higher than the benefit of aspirin, making it inadvisable. Conversely, in secondary prevention, the priority is to minimize the risk of new cardiovascular events. And in this context, aspirin is a powerful and necessary tool. This change in recommendations is relatively recent and has caused some confusion, particularly in the media and among the general public. However, doctor's message is clear. Supplements. Studies suggest that omega-3s help reduce platelet stickiness, making blood less prone to clotting. This may help lower the risk of clots in people with low to moderate risk. Additionally, omega-3s offer extra benefits, like reducing triglyceride levels and supporting brain and eye health. Turmeric. Turmeric, a spice used in traditional medicine, contains an active compound called curcumin. Curcumin has anti-inflammatory properties and may have a mild effect on blood clotting. It helps reduce inflammation in blood vessels, a factor that can contribute to arterial plaque formation and eventually clots. Ginger. Like turmeric, ginger is known for its anti-inflammatory properties. It also acts as a mild platelet inhibitor, reducing their ability to clump together. Drinking ginger tea or adding ginger to one's diet can be an additional option for those looking to support cardiovascular health naturally. Nattokinase. Nattokinase is an enzyme derived from natto, a traditional Japanese food made from fermented soybeans. Studies suggest that nattokinase can help break down fibrin, a protein involved in clot formation, potentially providing a natural anticoagulant effect. However, its use is still under study, and it is not recommended as a direct substitute for anticoagulant medications in high-risk individuals. Garlic. Garlic has been used in natural medicine for centuries, and some studies have found that it may have a mild anticoagulant effect. This is due to its active compounds, such as allicin, which also offer antibacterial and antioxidant properties. How to choose the right option. It's important to remember that while these natural methods can offer benefits, they are not direct substitutes for aspirin or other anticoagulants for those needing strong clot prevention. Although natural alternatives generally have a lower risk of side effects, they also tend to be less effective at preventing serious cardiovascular events in high-risk individuals. For example, in cases such as atrial fibrillation or post-heart attack, prescribed anticoagulant medications are far more effective than natural remedies. The role of lifestyle in clot prevention. Beyond medications and supplements, lifestyle is one of the most crucial factors in cardiovascular health. Maintaining a healthy diet, Exercising regularly and avoiding tobacco are pillars that help reduce heart disease risks. Sometimes, lifestyle changes can make a significant difference and decrease the need for additional medications. Aspirin and atrial fibrillation. Atrial fibrillation, or AFib, is one of the most common heart arrhythmias and affects millions of people, especially as they age. But what exactly is atrial fibrillation, and why is it such an important topic when discussing aspirin? Let's start by understanding what happens in the heart during atrial fibrillation. The heart has 4 chambers, 2 atria at the top and 2 ventricles at the bottom. Under normal conditions, the atria and ventricles work in a coordinated rhythm. However, in atrial fibrillation, the atria do not beat regularly or in an organized manner. Instead, they tend to quiver or fibrillate. This occurs when the heart's electrical signals become irregular and fast, disrupting the normal heartbeat. Why is atrial fibrillation a problem? Atrial fibrillation affects the ability of the atria to pump blood efficiently into the ventricles. As a result, blood can become stagnant in the atria, particularly in a small cavity called the left atrial appendage. When blood pools in this area without moving properly, the risk of clot formation increases. These clots can then enter the bloodstream, and if they reach the brain, they can cause a stroke. For people with atrial fibrillation, the risk of stroke is 5 to 8 times higher than in those without this condition. The role of aspirin in atrial fibrillation. For many years, aspirin was considered a treatment option to reduce stroke risk in people with atrial fibrillation, especially for those unable to take stronger anticoagulants. Aspirin reduces clot formation by acting on platelets, but recent studies have revealed that aspirin is not as effective for atrial fibrillation as once believed. Unlike other anticoagulants, such as NOACs or warfarin, aspirin doesn't block specific proteins in the clotting process at the same level. Research suggests that clots formed in atrial fibrillation have characteristics that make them less responsive to aspirin's effects. These clots seem to rely less on platelets and more on other clotting factors, meaning aspirin has a limited impact on them. For this reason, in the past decade, experts have recommended more effective anticoagulants for people with atrial fibrillation, especially when the risk of stroke is high. Anticoagulants for atrial fibrillation. For patients with atrial fibrillation, doctors often recommend more potent oral anticoagulants, such as Xarelto, Eliquis, or warfarin. Unlike aspirin, these medications inhibit specific parts of the clotting cascade, particularly factors like thrombin or factor XA, which play a key role in clot formation. These anticoagulants have proven to be much more effective than aspirin in preventing strokes in patients with atrial fibrillation. In fact, aspirin is no longer considered a first-line option in these cases. What does this mean for patients? For many people with atrial fibrillation, knowing they must take stronger anticoagulants can be concerning, especially due to the associated bleeding risks. However, the benefits of these anticoagulants usually outweigh the risks. For example, they have been found to reduce the risk of stroke in people with atrial fibrillation by up to 70%, a substantial figure when dealing with such a dangerous condition. Natural alternatives and the role of lifestyle. Alongside prescribed anticoagulants, some patients seek to complement their treatment with natural alternatives. While options like fish oil or turmeric have mild antiplatelet effects, they should not be considered substitutes for anticoagulants in cases of atrial fibrillation. However, maintaining a healthy lifestyle can have a positive impact. Keeping a healthy weight, controlling blood pressure, and reducing alcohol intake can help manage AFib episodes and reduce their frequency. Personalized recommendations for aspirin use. If you're currently taking low-dose aspirin to prevent heart attacks, it's crucial not to make any changes without consulting your doctor first. While it may seem like a simple decision, stopping or adjusting your aspirin use can have significant health implications. A conversation with your doctor can help confirm whether your daily aspirin regimen is still appropriate or if new guidelines suggest an alternative approach. Current recommendations indicate that some patients might benefit from taking aspirin only a few days a week instead of daily. However, this strategy depends on specific factors such as your age, medical history, and any underlying conditions. For individuals aged 40 to 59, it is essential to discuss any aspirin recommendation with a healthcare professional, even if you were previously advised to take it. Medicine is constantly evolving, and guidelines may change as new evidence emerges. Although aspirin is an over-the-counter and widely used medication, it should not be taken without continuously assessing its risks and benefits. Aspirin recommendations by age group. 1. Ages 40 to 59. In this age group, the decision to take aspirin as a preventive measure should be entirely personalized. Your doctor should consider not only visible risk factors such as high blood pressure, elevated cholesterol, or a family history of heart disease, but also factors like lifestyle, physical activity levels, and the presence of conditions like diabetes or metabolic syndrome, which can increase the risk of cardiovascular events. This personalized approach is essential because while bleeding risk is significant, it remains lower than in older individuals. 2. Ages 60 and above. For those over 60, caution is even more important. Studies show that the risk of gastrointestinal and cerebral bleeding increases significantly with age, which can turn the potential benefits of aspirin into disadvantages. Although cardiovascular issues are more common in this age group, new guidelines indicate that daily aspirin for primary prevention of heart attacks is no longer the general recommendation. This means that, in most cases, taking aspirin without a history of cardiovascular disease may carry more risks than benefits, and other preventive strategies may be safer and more effective. 3. Under age 40. Current research suggests that there is no proven benefit to daily aspirin use for primary prevention in people under 40. The generally low cardiovascular risk in younger people and the potential for adverse side effects mean that aspirin is not recommended as a preventive measure in this stage of life without a specific medical need. When is aspirin appropriate? Aspirin something so small can have such a profound impact on people's lives. However, as we've seen, aspirin is not a universal remedy, and its use requires careful evaluation. It's clear that aspirin can save lives, especially for individuals with a history of heart issues. In cases of secondary prevention, when someone has already experienced a cardiac event or has significant risk factors, aspirin can be a powerful tool. However, for those without high risk, the balance between its benefits and risks is less straightforward. Potential side effects, like gastrointestinal or cerebral bleeding, mean that aspirin use must be personalized and considered carefully. The question of who should and shouldn't take aspirin is unique for each person. Consulting a healthcare professional who can review each individual's medical history and current risk factors is essential. Making an informed decision with a doctor's guidance is the first step to ensuring that any treatment, including aspirin, provides more benefits than risks. For those for whom aspirin may not be the safest option, there are effective alternatives and natural options that, along with a healthy lifestyle, can help protect cardiovascular health. Prescription anticoagulants, although requiring monitoring and supervision, offer essential prevention for those needing stronger measures. And while natural options like fish oil and turmeric have beneficial properties, it's crucial to remember that their effects are mild and do not replace medical treatments for high-risk individuals. Lifestyle remains one of the most powerful tools for protecting the heart. Maintaining a balanced diet, exercising regularly, managing stress, and avoiding excessive alcohol or tobacco can reduce the risk of cardiovascular diseases just as much as, or even more than, some medications over the long term. For those aiming to improve their cardiovascular health, the first step is regular checkups. Knowing your cholesterol, blood pressure, and glucose levels can give you a clear picture of your risks and help you make appropriate preventive decisions. Remember that medical advancements have brought new options and recommendations, and staying informed is essential. Thank you for joining us in this video. We're here to help you make informed decisions and maintain a healthy life at every stage. Ever wondered how you could boost your energy and support your health naturally? Much like the personalized approach we discussed with Aspirin, Java Burn might be the perfect addition to your morning routine. This all-natural coffee enhancer not only boosts metabolism, but also provides sustained energy throughout the day. No artificial additives, vegetarian, GMO-free, and gluten-free, so it's a great fit for a balanced, health-conscious lifestyle. If you're ready to upgrade your mornings, click the link in the description to discover how Java Burn can fit into your wellness journey. Remember to subscribe to the Wellness Insight for more expert tips on health and wellness. If you found this video helpful, don't forget to like, share, and let us know your thoughts below. And stay tuned for our next video to explore more ways to enhance your health naturally.